on Human Trafficking. This is the third day in our fourth day in the 4-day event. For those of you joining us for the first time, my name is Ben Blake, and I'll be moderating today. I'm a fourth-year medical student here at VCU and applying into internal medicine residency. I would like to extend a heartfelt thanks to our donors for sponsoring this year's symposium. Our donors come from across the U.S., and we wouldn't be able to offer this symposium free of charge without their support. Thank you. Also, I'd like to thank Dr. Peter Buckley, Dean of VCU School of Medicine, for his steadfast support for our educational efforts. Before we begin, I'd like to go over a few logistics. The presentations today will be recorded. Please keep yourself on mute throughout the presentation unless you have a question. If you have a question, either unmute yourself to ask or write your question in the chat box. I, along with the other moderators, will be monitoring the chat and will ask on your behalf. If you have a question that you'd like to ask anonymously, please send the chat just to me and I'll ask without using your name. The content and discussion in this presentation will necessarily engage with issues of human trafficking, which can include sexual and physical abuse. Some of the content will be emotionally and intellectually challenging to engage with. I, along with the other moderators, the presenters, and all others who are speaking, will do our best to make this virtual meeting a space where we can engage bravely, empathetically, thoughtfully, with difficult content throughout the symposium. Whether you're joining us from Richmond, the West Coast, or from a location outside the US, we're really happy to have you join us. To get a sense of who's with us this afternoon, we'd love to hear where you're joining us. If you could put your location in the chat box, that would be great. I'm excited to introduce our next speaker of the day, Lauren Harris. Ms. Harris is an educator at Fairfield Middle School in Henrico County, Virginia. Previously taught human trafficking survivors in a safe house for several years in Louisiana. Through working firsthand with human trafficking survivors, she developed her own trauma-informed response that she uses to support and empower survivors. Ms. Harris, thank you so much for sharing your time and expertise with us today. This session will begin with a presentation recorded by Ms. Harris, who will then join us for a question and answer period following the presentation.
Lauren, I know you're here, so do you want to say anything before I share the presentation, or do you want me to go ahead?
I put the intro in the presentation, so you can go ahead and play. Thank you.
Perfect, will do.
Hello, good afternoon. My name is Lauren Hicks, and my topic today is empowering survivors of human trafficking. So understanding the principles of trauma-informed care can help one respond with understanding and empathy. So before we start, I just wanted to thank everybody for their time today. Thank you, Ms. Shemo, for allowing me the opportunity to come here and raise awareness and share my experience with interacting with trafficking survivors. So again, thank you all so much for being here. A little bit about myself. I'm an ELA teacher, and I taught ELA with adult education for 7 years, and the students that I taught included English language learners, or ELLs, most of who were refugees trying to obtain their citizenship or just enhance their English language skills, male and female inmates at prisons and jails, and human trafficking survivors, all of which were minors, and the youngest student I have ever taught was 12 years old. And currently, I'm teaching 7th graders at Fairfield Middle School for Henrico County Public Schools. So what will we discuss today? So yes, we're going to be talking about trauma-informed care and how we can implement that in your profession. So whether that be, I know most of you are doctors, so how you can implement that with your patients or in any profession. And I'll share my experience of how I learned that approach and implemented that as a teacher in the classroom. what is trauma? So trauma is just an emotional response to a horrible event. It's an emotional response. So that can include fear, outbursts of anger, mistrust, and so forth. Now, what is trauma-informed care? That's recognizing the trauma and then recognizing those symptoms and acknowledging how they impact the student or the patient, rather, the patient's behavior. So how they impact that behavior, because they definitely will impact the behavior. So the principles are safety, choice, collaboration, trustworthiness, and empowerment. In case you're not familiar, I wanted to just backtrack and define human trafficking. So what is it? The use of force, fraud, or coercion to obtain a labor or commercial sex act. How? How does this happen? Many ways. So there are threats, promises of romantic relationships or love. One might be tricked into this before they realize what has happened. And I have a short story. Teachers always have a story about the time when I was visiting New Orleans. At the time, I was living there, living in Louisiana, living in Baton Rouge specifically. And every Friday, my husband and I would visit New Orleans for our volunteer work. So just to backtrack before I get into my story, just to give you guys an idea of numbers. At that time, in 2015, the largest gap wherein which people were sold was Houston, Texas to New Orleans, Louisiana. So keep this in mind as I tell this brief experience. So we were in New Orleans that day on Decatur Street. Now, if you're familiar, you understand how much foot traffic that street gets, including the French Quarter. And you understand how when you go into one store, it connects to another and another street and so forth. So I was in H&M and I noticed some woman there. I noticed that she's very fixed on me because I feel her staring and I start to get uncomfortable. So I say hello. I initiate conversation because she's been staring, right? So I noticed that she doesn't have any shopping bag. She doesn't have any belongings, no purse. And long story short, she makes conversation. Hello, how are you? Oh, you look so nice. Then she proceeds to invite me to a pool party. Now, again, if you've ever been to Louisiana or any of the southern states, you know that it is extremely humid. So it was summertime. So her invitation wasn't really too off the wall. So she invites me to the pool party, all expenses paid, alcohol paid for, come, meet new friends, have a good time, all expenses paid. I wasn't planning on going to the pool party, but she proceeds to push a little bit and ask me, will I attend? What do you think? I said, let me get back to you. So I continued to shop.
Sorry to interrupt the video, everybody. Is it less blurry when I take it out of full screen mode? Still blurry. Let's see. Thanks for your patience, everyone. Just a second. We'll see if we can get it better.
Hello, good afternoon. My name
Is that better, Faye? Yeah. Okay. I think we're The same. Okay. All right, everyone, this is the best clarity that we're going to get. So hopefully it's readable for everybody, and Lauren will be able to answer questions afterwards as well.
But she proceeds to push a little bit and ask me, will I attend? What do you think? I said, let me get back to you. So I continued to shop, and the next shopping rack that I go to, my husband actually happens to be there in the vicinity. So I said, hey, I just met this lady. She seems really nice, but she keeps asking me to a pool party. So he says, what lady? Within a matter of seconds, I turn around and she is gone. So what's the point of this, right? Let's fast forward to 1 year later, or a few months later, rather. I was in Baton Rouge. I had just accepted the position to teach human trafficking survivors at the new safe house that was built. And my boss wanted me to go to the conference just to learn a little bit more about it. And so there were quite a few survivors that spoke, but one in particular, her story I remember in particular. She was very studious. She had just graduated college. She never did anything for herself. And so she decides to go to New Orleans. She's in the French Quarter, and a woman approaches her. She invites her to a party in Las Vegas, all expenses paid, alcohol paid, just come meet new friends, have a good time. And that caught my interest. So she proceeds to say that because she was so studious, she decided, why not? She went to Vegas. The woman wanted her to meet her boyfriend. The woman, the survivor rather, thought that that was a little odd, but she went with it. The boyfriend was the abuser, and that's how she was tricked into human trafficking. When she gave her experience, chills immediately shot up my spine. The same description of the woman that she met matched the description of the woman that I spoke to a few months ago. And I never thought anything of it. Now, we can't be sure, but again, the description matched, and everything she said verbatim, all expenses paid for, matched. So I tell you this not to make anyone uncomfortable or scare anyone, but I tell you this to emphasize the prevalence of this and the seriousness of this, because we say this can happen to anyone, but we really don't come to a realization until you're close to it, or until you realize that you might have run into this. So the principles that we'll discuss today are safety, choice, collaboration, trustworthiness, and empowerment. So I have a quote. I love opening up my classes with quotes. This says, "I will not let anyone walk through my mind with their dirty feet." Gandhi. So as we continue in this talk today, think about whether or not you are the dirty feet in someone else's mind. Think about if you want to be a positive force or a negative. Physical safety. So that is ensuring physical and emotional safety. The environment is welcoming and privacy is respected, and there's confidentiality. So the safe house that I taught at, it was actually on police grounds, and I would actually leave the prison and head straight there. And there were no directions given to me or any of the other teachers. We had to memorize it by heart. When we first went there, we got someone to take us and we followed them. And like I said, everything had to be memorized, and only certain teachers were assigned there, as well as certain officers. So some of the officers that I worked with, not all of them knew where it was either. So it was very secure. It was very secure. And the ladies there, they had their own rooms and they had their own bathrooms in their bedrooms. And if they had children, then their children had their own area. Very rarely did I see one of their children unless I was helping them with them. So privacy was respected and confidentiality. Everything that the student said, the location, everything stayed with us. So that would be kind of the same confidentiality that you have with your patients. Let's talk about communication before we get into emotional safety. So most communication, as we know, is nonverbal, and behavior is a form of communication. Behavior is a form of communication. So with that in mind, it's important to understand when interacting with human trafficking survivors, you shouldn't take any attitude or any aggression personally. Okay? What you can expect will be anxiety, troublesome thinking patterns. They may be withdrawn, and they may have problems handling essential and simple tasks. So keep this in mind as we talk about emotional safety. What does that look like? So people are comfortable sharing raw emotions, thoughts, and ideas. And again, we have that same confidentiality. So before starting the position, my boss emphasized the need for us to just be prepared for attitude and off-the-wall comments. Those were her exact words. She said, be prepared for attitude. Why? Survivors have been trained to give attitude. Think about it. When someone is not approachable, you don't make small talk. If small talk doesn't occur, questions don't get asked. So they're trained to have that attitude, and then what they have been through naturally helps with attitude. That would be with any of us. It would naturally aid in us having that attitude. So what did that look like for me? So me, as well as the other teachers, we made the classroom a safe space. So students were free to share experiences without being shamed. So we never told them, that isn't a conversation for the classroom. We know that, especially now, teaching includes that social and emotional learning aspects, but especially with traumatized youth. So you never want to shut them off from sharing something with you. And it also looked flexible for us. So we had to let go of what we planned for class, or you might have to let go of how you think this next doctor's appointment is going to take, or how long it's going to take, or how it will go. I have a story, another story. I was with a student and we were going over decimals. She just could not get it. Granted, math was not her strong point, but She couldn't focus that day. She was very fidgety. She was more frustrated than normal. It was like a block. So I continued to warmly do one more with her, say, let's do one more and let's take a break. She says, okay, I'll do one more. She stops and says, Miss Hicks, for some reason, this reminds me of the time that I lost my baby in the hospital and my mother blamed me and she said that it was all my fault. And now I really wonder if that is my fault. I wonder if that was punishment for me. So after I spoke with her privately, I completely scratched my plans. I told everyone we're taking a mind break. We're going to walk outside on the trail, come back and complete our classwork. So having a trauma-informed response includes being adaptable and flexible. And it's important to note that people don't choose when they are going to become triggered or when memories are going to flood in. I would have never in a million years, and I still to this day, I don't know what exactly about the decimal worksheet that it was. It possibly could have been the numbers and maybe she memorized the time of death. I don't know. So we don't know when someone will be triggered, and being triggered is not a choice. It doesn't happen like that. So that's also important to note. More safety, emotional in particular. Like I said, I start my classes off with a quote or a daily journal. And so if there's ever any sensitive information that the ladies didn't want to share with their classmates, I didn't make them. And if sometimes they didn't want to share it with me, I didn't make them either. So I was very adaptable and flexible with them. Why give them that option? Why did I give them that option that maybe I might not have given some of the other students at another center? Because reading aloud brings stories to life. And we must avoid re-traumatizing the students or the patients. And so by making them read the sensitive information to their classmates when they are not ready, that could be detrimental. So flexibility with them is key, and flexibility with yourself is also key. Because as that trust develops, you will hear a lot of things that will make you uncomfortable. They're going to open up to you a lot more. You are going to hear very vivid descriptions of things that they have been through as they start to open up to you. So you must remember, if you are uncomfortable hearing it, just think that this is something that they have lived. So watch your facial expressions, watch your body language. Remember, behavior and body language is communication. So make them feel welcomed to share again. You don't want them to leave your doctor's office feeling, oh no, I can't say anything. She couldn't handle it. I told her A, B, C, and D, and she completely broke down and cried. So I don't think I can talk to her about that. Remember, it's not about you. You want to make them feel that they can share anything. More emotional safety. Just to wrap up, safe space is often a phrase that's thrown out, but once my students really saw that class truly is a safe space, they started, like I said, sharing more. They started sharing poems and artwork and engaging in conversation. And you're going to have just normal conversations. Every conversation isn't going to be them telling vivid accounts of what they've been through. They're going to start seeing you as that teacher who you can just to about anything, or the doctor who you can talk to about anything. So never give up in building that trust. Choice. What does that look like? The individual has choice and control. Individuals are provided clear and appropriate messages about their rights and responsibilities. So, what did that look like for me? How did I implement this in the classroom? Students were given a list of class expectations on the very first day. It's important to hold them, or your patients, to those expectations. It's not a favor to let them slide because of what they've gone through. So yes, you want to be empathetic, but empathy does not mean a free pass, because what happens is the students or the individual will lose respect for you, and it's only going to hurt them later on. They're only going to look for a pass to see if somebody will give me a pass, just like Ms. Hicks did or whomever did. So balance is key. So I have another story. I will call this student rebel, or the rebel student. So there were 3 teachers. There were 3 of us. And I and another teacher met student rebel the previous week. And another teacher that we worked with, she did not meet her. So this day was her first day meeting her. So the previous week, I, as well as the other teacher, went over expectations with dress and grooming. So this student rebel, comes downstairs to class with very short and tight shorts, blue jean shorts. Now, I saw her enter the classroom with those shorts. I was waiting until she got settled in her warm-up before reminding her of the expectations. Now, the other teacher who hadn't met her before immediately comes in, guns blazing, yelling, "Go upstairs, change, you know you're not supposed to," just very explosive. And so student rebel explodes back because she's the rebel of the bunch. And there wasn't any effective communication. There was screaming. I had to go down the hallway and get their guardian involved. So how could that have been different? Or why did that happen? We have a couple of reasons. One, she's the rebel of the bunch. Every classroom has 1 or 2. And she was testing us, whether or not we would stick to the expectations. 2, she wasn't viewed as an individual. So you cannot discipline each student the same way. Now, we had a couple of students who they walked in the classroom barefoot. All I had to do was look at them. They started laughing and said, "I'm going to go get my socks and shoes." You can do that with some. With this student in particular, student rebel, you have to ease or let her become at ease before you firmly remind her of those expectations. So we had a similar incident with that same student rebel. This time she was off task, and I believe it was her shoes. I don't believe she came to class dressed appropriately. I made small talk, asked her how she was, how she's feeling. I looked at her. She looked down in her shoes. She said, I'm going upstairs to go get my shoes. So you have to find a balance with that choice. Yes, you have to show empathy. But remember, doing them favors will only hurt them if you let them slide. And also, coming in abrasively and aggressively when they do get off track, with some of them, it's not the best method. So the key here with choice is not to do any favors and balance. Having a balance or showing reasonableness. Collaboration. What is that? So that's making decisions with the individual and sharing power. So individuals are provided a significant role in planning and evaluating services. So what did that look like for us in the classroom? So we gave them choices with the subjects. Did they want to work on math that day? Did they want to work on language that day? Also, we let them decide, where do you want to do class today? Do you want to do class inside, outside? Do you want to start on the computer first, then do your journals outside? And then we had free write journals. So they can choose one topic or their own topic. And then every April for National Poetry Month, we created a poetry wall. And they were very creative. And so they loved that. They can create their own poem, and it can be in any form. It can be in a song. Some of them wrote epic poems. Some of them wrote haikus. It can be any form of poetry that they wanted. So giving them some of that choice and that sharing power. I have another story. I'll call this student shy. There was a bilingual student, and I spoke Spanish, but her language was a tribal language, so it was only 20% Spanish. And there was another staff member there. She didn't speak Spanish. She spoke Italian. So communicating was a bit of a challenge. I actually got her into the ELL or ESL program. But long story short, the student was pregnant. Student Shy was pregnant. And she was sexually assaulted and became pregnant as a result of that assault. She had expressed not wanting to keep her baby. And back to the emotional safety aspect, she told me and two other teachers that, because she trusted us. So she wouldn't really speak to everyone. So she confided in us and told us she is having second thoughts. She doesn't want the baby. There were a lot of staff there. Some of the staff lived in the house, and others, like myself, we just came in for a few hours throughout the day. Well, the staff who lived there redecorated her bedroom. They put a crib in there, set it up to be a nursery, got toys, got baby clothes in there. And remember, privacy is also a part of safety as well. When the student went upstairs and she saw her room was a nursery, she completely shut down. And this is student shy, so she's quiet. She had anxiety up to here. She was yelling, bouts of anger, outburst. So why? Why did that happen? She was not heard. Make it a point to hear the patient or the student in each stage of their thinking process, whether we agree with what they're saying or not. So the staff members in there, they had very strong beliefs, and that's fine. However, remember, when we are dealing with traumatized youth or traumatized survivors, it is not about us or our beliefs. They re-traumatized her by not giving her that voice, that collaboration. It was not there. Now, she went on to have the baby, and she was very happy with the baby. But the point was that in that moment, she was expressing that she didn't want the baby. She was having doubts, and that should have been okay with the staff there, because we want to listen. We don't want to disregard the survivor's voice. We don't want to listen with the intent to respond, but we just want to listen. We want to listen to hear them. Trustworthiness. What is that? Task clarity, consistency, and interpersonal boundaries. Respect and professional boundaries are maintained. So, I never got overly familiar or comfortable, even though it was a house. So, when we think of school, there was a room designated as a classroom, but it was a safe house. There was a kitchen in the front, there was an office, upstairs were the bedrooms, the living room, the TV. So it was a house, but I never allowed the environment to make me comfortable or overly familiar. I knew my role as the teacher as well as the other teachers. We knew our role. We also never played favorites, not only as teachers, but especially with human trafficking survivors, because so much of their worth has been connected to their physicality. That could be damaging to them if they sense you are playing a favorite. So we never want to adopt a persona that resembles their abuser. We just want to view and care for them as individuals. They are the students, we are the teacher, or they are the patients and you are the doctors. We have to maintain that professional boundaries at all times. And that can also help instill their trust in us, because for some of them, it was people in authority, even for some of them, their parents, who didn't maintain that boundary. So by us maintaining that boundary, we can slowly start to change their view and they can develop that trust. Empowerment. What is that? Prioritizing empowerment and skill building. Atmosphere allows individuals to feel validated and affirmed with every staff member. So we taught life skills. We did lessons in which the students had to create an incident report. They had to write a resume, and we did mock interviews. They were required to dress for an interview. Have them dress for that interview just as if they were to go to that interview. And we want to set them up to succeed. So we want to empower them in every way possible. So in summary, safety. Creating a safe space both physically and emotionally. And I want to pivot back to this. I failed to mention also with the flexibility aspect of safety. Because of the nature of human trafficking and because all of my students were minors, some of which were 12 years old, they went to court and their court cases were federal because of the nature of it. And after court, needless to say, it was an intense case. Them getting up and making statements and being interviewed was intense, as well as the therapy session. So whenever they had a court case or they had therapy, we were flexible and just let them come downstairs whenever they were ready, since we were there for about 3 hours at a time. Choice. Hold the individual accountable. Favoring or doing favors will only hurt them, and it diminishes respect for your authority and your professional opinion later on down the line. Collaboration. Involve them. Involve them in decisions. Hear their voice. Trustworthiness. Maintain your professionalism. Empowerment. Set them up to succeed in every way possible and encourage them. And finally, I'm going to end with a quote by Maya Angelou. I've learned that people will forget what you said. People will forget what you did, but people will never forget how you made them feel. So with trauma-informed response, trauma-informed care, that is what this is about. How will the patient or the individual walk out feeling? Are you going to be the dirty feet in their mind, or are you going to be a force of good and positivity? So you can contact me here. I have my 2 emails here. And again, I want to say thank you so much for coming. Thank you for allowing me to speak here today. And if you have any questions, I will take those now.
Thank you so much, Ms. Harris, for that awesome and thorough, very informative presentation. I think that your commitment to the people that you serve just really shines through. So I'll go ahead and open up to the audience for any questions, and also to you, Ms. Harris, for any words that you want to share.
One of the things we've talked about, especially when working with adult victims of human trafficking, is, and you mentioned trauma-informed care and the value of that, is making them feel like they're in control and they kind of get to make choices about what's going to happen next. I think for those of us who are working in clinical roles with children, in my mind, one of the really hard things about dealing with these cases and when you have to get CPS involved is that it's hard for the child to feel like they're in control, like they're so small and the system is so big. And I'd love to hear from your perspective, what are some ways specifically for clinicians that are kind of getting children involved in these huge systems that move so slowly and don't always do an amazing job valuing a child's voice? How do you help a child feel heard and give them some kind of semblance of control?
That's a good question, David. We ran into that a lot because the students that I taught were minors. And the only difference was their parents weren't in the picture, so they were at a safe house. So they kind of had more of a voice. But when it comes to being a patient as a minor, I'm I'm honestly not sure what exactly that would look like, them being patients and minors when CPS is involved. But that is a good question. I wish I had more for you.
Catherine Hopkins, I think you raised your hand to ask a question.
Yes, I did. Can everybody hear me? Yes, my question would be, I know I've worked with domestic violence survivors in the past, and a lot of the domestic violence survivors would end up returning to their abusers, but then maybe come back to shelter. With the human trafficking survivors that you worked with, or just in general, did you see any of them return to their survivors? Is that something that is just as common with human trafficking survivors as it was with domestic violence survivors?
Yes. So Katie, that's my younger sister. So yes, unfortunately, even though it was a safe house, they were able to contact their abusers, and it was very secure. So thankfully, none of them made it to the safe house grounds, but they did contact their abusers and get in touch with them again. But they weren't able to find their location.
Another question from the chat is, we were talking about the stages of change in the last session. It seems obvious that trauma-informed care is what is needed to help survivors move through the stages of change. Do you have thoughts about the relationship between trauma-informed care and the stages of change?
Trauma-informed care and the stages. I'm sorry, can you repeat the question?
Sure. So the stages of change were discussed in our previous session, being like pre-contemplation, contemplation, etc. And the question asker says, it now seems obvious that trauma-informed care is what is needed to help survivors move through the stages of change. Do you have thoughts about this relationship between trauma-informed care and the stages of change?
Right. So, and they are patients. And also to pivot back to David's question too, the connection, I think, would be just to get them involved, and if possible, to get them talking in sessions as much as possible. If that answers, if I think I'm understanding the question.
Yes, yes, thank you. Thank you, Lauren.
Okay, another question in the chat is, I was wondering during the time you were a teacher, for a student, like student trouble, how would you handle them getting off topic? For example, all students are doing their classwork, but then student trouble decides to stop doing the schoolwork and conversate with the other students off topic. Student is loud and distracting other students. How would you re-engage a student like student trouble?
Yes, so that happened a few times. Like I said, she was testing us to see whether or not we would hold to those expectations. So I handled it a little bit differently. Everyone has their own teaching style, but I handled it differently. I never showed irritation, especially in front of the other students, because with the nature of human trafficking, there is a power struggle. So I never showed that I was irritated with her behavior, as if to say that I was losing control of the classroom. So when she did do that, I would just give her a look, redirect her. If and when that didn't work, I would just bring her outside on the trail, and we would just have a chit chat. And it was always something to where she wanted to get off her chest, and she would come back re-engaged.
My question is from the chat, do you think that we as a society should focus on doing more to identify and get a better handle on this growing concern?
Definitely, definitely. So I also taught at a prison and a jail, and a lot of times they are criminalized because of the nature of it, of human trafficking. So I definitely think that that is important as a society.
And I had a question just about, Ms. Harris, how you dealt with having to kind of ingest and digest other people's trauma throughout your time and throughout your work. Like if you sought counseling or if you could speak to that at all.
Yes, so I did not seek counseling. Looking back, I might have needed to. There were, for instance, when we got student, I'll call her student quiet number 2. She was 12 years old, and when I left that day, I completely just broke down in the car on the way home. And there were also a lot of days like that because, like I said, once they start seeing you as the teacher that they can open up to, I heard a lot. And then when they would contact their abusers, early on, when I started teaching them, I started to feel guilty for some reason. I took that guilt upon myself. So self-care, stepping away, doing, I don't know, jogging or anything to bring my focus back onto something else. And that's what I would suggest, because it will get to you.
Ben, did you want to read the chat, or do you? I can. So the next question is, so it seems that giving the students an opportunity to refocus outside of the stressful environment seems to help diffuse the situation.
Yes, it does. It definitely does. It helps diffuse and prevent other situations. Like I said, because of the nature of trafficking, there's that power struggle. So when new students would come into the house, for instance, we had a jealousy issue between 2 of the students. One was in choir, and the other one, she also liked to sing. So that they were jealous. And so that definitely plays a role, just having them refocus and making sure that they know everyone is on the same playing field here and not having a persona that reminds them of their abusers. So refocusing definitely helps.
And then the next question in the chat is, does your school have a prevention curriculum on human trafficking? If not, is there administrative resistance to address this problem?
So the former school that I taught at, they did, and I do believe Fairfield, if I'm not mistaken, Impact Virginia partners with Henrico County Public Schools. If I'm not,
I think it's actually it's Richmond Justice Initiative. They're another local nonprofit. Yeah. Oh, okay. So they have their curriculum in your school?
I believe so, but I will double check. This is my first year at Fairfield Middle School, and we've been virtual, so I will definitely double check on that.
Oh, okay. Great. Thank you.
And then Jana, to answer your question, the recordings for all of these sessions will be available on the Impact Virginia website. And then I have a question in the anonymous chat. If it was a safe house, why were they allowed to contact their abusers?
Right. So they were not allowed to contact the abusers. There was actually an IT personnel who came there, and he was the only IT personnel, and he blocked off access. However, they somehow overrid it. So they were definitely not allowed to contact their abusers.
As somebody that has worked a lot with these children, I'd love to hear, sometimes providers, medical providers, we live in a bubble and we're not always aware of how we come across to other people doing really important work. I'd love to hear either through things that children have said to you about their experiences with providers, or your experiences with providers kind of around this work with children. Is there anything you've seen providers do that, as future providers on this call, would learn well not to do, things that you've seen that you're like, I really wish they hadn't said that to this child, or I really wish they had done this, but didn't?
Definitely. So one of them, they would go to get their checkups, and one of them just told me that she felt very marginalized and put in a box as if it was her fault, or as if she was just disposed to be human trafficked, as if that was an eventuality for her. So I guess just remembering that this can happen to anyone, no matter what their background is.
And then our next question is, where can we see Lauren in other presentations?
We will have her back.
And then the follow-up question, another question is, are you now involved in human trafficking teaching to students directly in school, i.e. teaching students, or in training teachers and educators?
I'm not. So this is my first year at Fairfield Middle School, and I'm an English teacher, but I would love to do that. I would love to have the opportunity to inform educators on this, because a lot of times we and you all are their first point of contact. So I would definitely love to have that aspect in the classroom.
And that's the last question I see in the chat right now. If anyone has any other questions, feel free to unmute yourself and ask, or put it into the chat.
Lauren, thank you so much. It's a real pleasure. This is your first time to speak at our symposium. We will have you back next year and maybe even earlier.
Thank you.
That would be wonderful to plan another presentation.
Thank you for having me.
Oh, our pleasure. Thank you. Ben, do you want to do the survey?